Hi, everyone. This is Mike Higdon again with Renown Rounds. We're now on episode 5, and we're still talking about the strategic plan at Renown Health. And today's episode is going to be about providing essential and advanced care options. So I have with me Sam Weller, the CEO of Renown South Meadows Medical Center and the Renown Rehabilitation Hospital. And to my right, I have Chris Nicholas, CEO of Renown Regional Medical Center. But I would hope that you guys can tell me and the audience a little bit more about yourselves, especially now that we have two CEOs in the room. So I don't know if there's going to be a battle about who gets to win at the end.
Oh, we all know. So I'll start off. Sam Weller, been with Renown for about 2.5 years and came from Colorado and part of an organization in various capacities previous to that. But really enjoy being here at Renown and what we're doing, and obviously being part of the strategic plan. But just a little bit about me and my family life. We married to a wonderful wife, 6 kids, and that's the usual reaction. So I was looking forward to that. And just love the outdoors. And so when we were looking at moving out here to Reno from Colorado, it was we want to be close to the mountains. We want to enjoy skiing. We want to enjoy the water, Tahoe, and all that. And it's just been a wonderful place to be.
Awesome. That's great. How about you, Chris?
So Chris Nicholas, CEO for Renown Regional Medical Center. I've been with Renown for almost 10 years now, 10 years in March. Started my career at Renown in our inpatient rehabilitation hospital, and then progressed actually to South Meadows and some service line leadership. And then about 4 years ago, I came up to the regional campus, almost called it the main campus, and had the privilege of taking over as CEO there, and have been there since. Sam is definitely pulling up the average of kids, so my wife and I have one daughter, Maddie. I can name mine because it's only one. Just absolutely love the Reno area and just have a deep connection to Renown and what it does for the community and for the region.
Awesome. So in previous episodes, we've kind of briefly touched on the essential and advanced care options. Some of you might remember that Dr. Erling called it clinical essentiality, which is more of an internal word. So what we want to do in this episode is really break down what that means. And I think that this is going to be the one that really touches kind of your everyday patient, maybe more than some of the other high-level stuff and some of the internal stuff. So I'm hoping that you guys can, first battle over who gets to give us the definition of what this particular pillar means.
I'll cede to my colleague here.
Well, when I really think about that, the clinical essentiality or really providing essential and advanced care options is looking at our current footprint. And we'll talk about hospital care because when you look at all these pillars, they all interlock, right? That's the beauty of this. So it's the average patient, the day-to-day patient might visit our primary care or urgent care and ultimately end up in our hospitals. And how do we work together to provide the best experience and the best outcome for our patient? For this particular pillar, we're looking at how do we utilize our campuses in a different way between Renown Regional Medical Center as the trauma center that captures the patients from 120,000 square miles. How do we advance that care to keep care local? How do we utilize and leverage Renown South Meadows and the rehab hospital in a different way than we've historically done so to, again, elevate the care, create better access, and ultimately just have better outcomes for our patients. So looking at, again, our day-to-day service offerings at those campuses, we look at our physician makeup, both from an independent and an employed aspect, and are we aligned in particular specialties to create that access and better outcome for our patients, and optimizing those services.
Cool.
The only thing I'd add to it is really looking at it from a programmatic approach, and do we have the right resources, assets, people to deliver on all the things in this strategic plan and all the things that we know we need to deliver for our region. Backing into that, though, is the word essential. And I think that we have put an intentional focus on making sure that we have those essential services available to our patients, both in the ambulatory setting and in the acute setting over the last couple of years, which isn't always something that we've been as focused on as we are today, because it's really the bedrock of being able to build onto some of those advanced and specialty programs that we're focused on either developing further or implementing initially.
Okay, so I have a couple of things here I'm going to ask you about. So both of you kind of mentioned like a before and after, almost like a before or now. Is there examples that you can give from both of your different hospitals that's something that you were doing and now you're doing differently?
Yeah, you've got the best example. Go for it.
Well, since you gave it to me first, I was going to give it to you, but I'll start. Well, if you look at Renown South Meadows over the last, we'll say 4 years, we underwent a full master facility plan, and it really elevating the campus and creating capacity on campus to add outpatient interventional radiology services, 2 cath labs, 6 new operating rooms. Most recently opened is the Conrad Breast Center, creating a comprehensive breast program from diagnostic to wellness, all the way in between. That's a perfect example of certain services that we can utilize the South Meadows campus through that investment. And that's easy, that's accessible, and it's great care. Again, some of those services have been provided within the Renown network, but it's utilizing and bringing those services to South Meadows for the South End population, as well as creating capacity at Renown Regional to advance their care.
Yeah, I think the unique thing about Sam and myself and our relationship is oftentimes when you have hospitals in the same market within the same organization, they compete for services and oftentimes duplicate. We neither compete nor duplicate unless it makes sense for our community. And I think that that's unique because of the personality. Sam's a great partner in really looking at what belongs in which hospital and on which hospital campus. And I think because of that, we've been able to advance on both fronts. One is really growing South Meadows and the services that it has and the things that it can take care of, while also decanting the main campus a little bit to be ready and capable to take on some of those expanded and advanced programs. For instance, we brought ECMO in last year, so a life-sustaining treatment for patients that wasn't previously available in our region. We also began our transplant program in the last 3 to 6 months, which has been really exciting. All of those things take capacity, they take people, they take equipment. In order to do that, the volume of patients is not going down that need care in our community. It's continuing to go up, and so we're really starting to leverage South Meadows in the right ways. And I think we've even been able to expand some services down there, like interventional radiology and things like that, that allow us to really free up some capacity in our main hospital to take care of those critically acute patients, because we do see quite a bit of volume that transfers in from our rural areas that needs that higher level of care.
Yeah, and I'll add one more thing that just came up over the last couple months. We added stroke and accepting of stroke patients at Renown South Meadows. And if you look at it from a programmatic perspective, we've always had the comprehensive program at Renown Regional, providing great care to our community. However, it's the trauma center, it's the large campus, it's sometimes harder to get to, especially from further away. We had a patient just last week come in, and we had phenomenal response times and ultimately throughput for that patient for a better outcome. We stabilized the patient. Patient ended up going to regional, but by doing so and creating a primary stroke center at Renown South Meadows, we have more timely access, especially for our South community, and be able to get them into our stroke program, not just at one location, but at multiple. And so that's where we're advancing those essential services for our community.
Interesting. So real quick, you mentioned, and just to clarify, looking at multiple hospitals in the area, are you referring internally to just Renown, or are you talking about competitors also that you look at when deciding which programs to go for?
Oh, no, I think we're focused on our strategy and what we think we need to deliver for our community. What I was referring to is oftentimes in bigger urban markets where you have an organization that has multiple hospitals, the CEOs have a independent budget responsibility, and therefore they pursue that in whatever way that they see as most appropriate. And oftentimes it creates redundancies, duplications, additional resources that aren't potentially necessary. And when you duplicate programs, you essentially reduce the total volume of the clinical team's work. And so there's some competency in that, depending on the program, on how much volume you need to maintain a competency. So that's the beautiful thing about the way that we do this work at Renown is we don't necessarily have a specific place that we expect things to be. We just want them to be in the right place where patients can access them. And it's the most affordable option. It's the highest quality option. And so we really work together on how do we make sure that the right services are in the right place. A great example is about gosh, about 5 years, 6 years ago now, we made the decision to move a lot of the elective volume of one specialty down to South Meadows because it absolutely fits there, and it's the right place to provide that care. It's a more accessible, convenient, and a little bit more efficient for that outpatient elective work, and it's been a huge success. South Meadows has done a phenomenal job with the program. So it's really looking at those things and saying, where does the service belong, that we can deliver it in a cost-effective, high-quality, efficient way, and what's the right experience for our patients?
And don't get me wrong, Chris was saying that we're not competitive with each other. I think we're appropriately competitive with one another. We banter back and forth, and we've been encouraged not to banter so much in public.
Collaboratively competitive.
Exactly. We're rooted in the mission.
Yeah.
Gotcha. Okay, so I'm very visual, so as you're describing this, it's really interesting. The models that you're talking about maybe in other markets are, this CEO in this hospital wants to do 15 things, and this person wants to do 15 things, and a lot of them kind of overlap. Yeah. But you guys are actually taking like units of care or programs and kind of being like, okay, now this one moves over to you, and then I'll take some more trauma over here at regional, and you're kind of streamlining it in that way, which is, I think, really cool, it sounds like.
Absolutely. We're on the phone almost every other day, if not every day, talking through different pieces of what's happening at regional, what's happening at South Meadows, how do we collaborate in different ways and really create a seamless approach. So ultimately the patient doesn't feel a difference, right? Whether they come to South Meadows, whether they come to regional, they're going to get the care that they need within the network.
But it also sounds like they're probably potentially being bounced around less between physical offices or buildings. If that's the case, if they have to be sent somewhere for a certain thing.
Yeah, that's the hope.
Yeah, the breast center is a great example, right? We have now, all-in-one, one-stop shop for unfortunately people who experience breast cancer, from the diagnosis all the way through to the procedural and reconstructive work, and it's all done at South Meadows for the most part, whereas it used to be that was probably 3 or 4 different locations that those patients would have to go through during the duration of their care.
That's really cool. Breast cancer, I feel like, has come up a lot more in my life than I realized it would, and one of the things that people complain about all the time is being sent to all over tarnation, whether that's a city or being sent to another city. And I think that's something Dr. Erling talked about, was being able to cover more things that were sent, to California, I think is what he was mentioning.
Yep.
So what are some of the specific examples that you guys have brought in that people don't have to travel for anymore? Is that part of this pillar, by the way?
Yeah, absolutely. I mentioned a few, so ECMO and transplant are
so what is ECMO?
Please don't make me. That's the acronym, but it's a life-sustaining treatment for cardiac and pulmonary patients.
Okay.
So it really it's been around for a long time, but a lot of its prominence came during COVID because it became a kind of last stop shop for intervention for really severe COVID patients.
Gotcha.
And so not having that in our region was pretty critical, because sometimes patients couldn't get to the service that they needed just because of travel time and their clinical condition. And so being able to offer that here has already saved numerous lives, or given access to that care that potentially saved numerous lives. So that's big. Transplant, another huge one, because when you get a transplant, if you have to go to California or Arizona or whichever transplant center you previously chose, you typically have to relocate, and your support system has to relocate for a period of 3 to 6 months post-transplant, just to follow up and do all the testing and all of those things. And so it becomes very difficult on patients, especially Nevadans, to have to pick up and move to another state for a period of time.
Yeah, so that could be like your whole family essentially has to go move to one of those places?
It could be, yeah. Like if you have kids and stuff in school, and the spouses are, obviously one's the transplantee and the other is, the support system. Yeah, it could lead to the whole family having to kind of lift themselves up temporarily. So we're excited to continue to bring that. In the cancer space, we're beginning to target some of the, I'd call them novel or new therapies that aren't offered in our region today. And through our cancer strategy, which is part of this pillar, begin to offer those in our community as we see more and more people receiving those treatments, and unfortunately today leaving our community to get those treatments.
Gotcha. So that's a big deal. So I think we started this series at least 6 months ago. So the transplant center is new enough that it is now, the episodes that we talked about it had predated when it actually started. So it sounds like a pretty big deal.
We're on case 2?
Case 3, we'll be doing the 3rd case if we haven't already done the 3rd case.
Oh, you can track them like that specifically?
Yeah. Cool. So when you start the program, you have to do 3 cases, and then you can apply for the formal accreditation.
Gotcha.
So we're going through that process now.
That's wild. I didn't Figured you could just set up a refrigerator and start going.
Yeah, no.
There's a lot of work up to the patient to get to that point for actual transplantation.
Gotcha.
But yeah, when we talk about keeping care local, I think that's a real mission orientation for us, because when people have to leave for healthcare, not only is it typically more expensive from a payer perspective, it's obviously a huge encumbrance for the families that have to travel, even if it's for the one-time visit or if it's for the multiple visits. So we've really honed in on those things that our patients are having to leave our community for, and try to bring those services to Northern Nevada. Now, we're also realistic in the fact that there are certain things that we're not going to do just based off of population size, that will have to go to those quaternary centers in Utah and in California.
Oh, yeah. I think Dr. Erling mentioned that in the first episode, just this idea that there was the opposite. So transplant's really important, but then there's things where you see maybe 5 a year, and he talked about practicing, the idea of practicing. A doctor literally can't practice if they only do 5 a year.
Yeah. It's the competency aspect, not just the physician, but also the staff. They have to be able to be competent in the services that they provide to support the physician in that work.
Gotcha. Yeah, that makes sense. So is there anything specifically that you've pushed out that you want to talk about, or is it kind of different things that's hard to quantify?
Can you ask
Or maybe not pushed out,
question?
but
Sorry.
are there, I'm trying to remember what specific service he said was something that Renown wasn't going to cover anymore.
Oh, it would be things like, open heart for pediatric patients, at least for the foreseeable future. Obviously, cardiac transplants, things like that. Things that we just don't have the population count for, that enough patients in our region would need that type of care to maintain the competencies of the teams and the providers and make it a viable program.
Burn is another example.
Burns is the only thing in trauma that we don't do. We send our
interesting.
patients to a burn center, which is fairly common.
Yeah.
And you have those kind of regionally located. And so there are certain things that we're realistic about that are maybe not a never, but not for now and not for a while.
Gotcha. That makes sense. One of you mentioned rural and just bringing the community in or keeping people in Nevada. And that's come up a lot in the School of Medicine's work too, trying to create, or graduate doctors who go out into rural communities. So how is Renown kind of reaching out to rural communities, or how do you interact with them more differently than you used to?
Yeah, I'll take it and you can add into it. So in 2022, like many organizations, healthcare organizations and tertiary hospitals is what we would call ourselves, had really kind of closed their doors, not necessarily to everybody, but really because of just the volume of patients and the limitations around workforce and all the challenges that healthcare organizations faced. It became more challenging to get patients transferred into tertiary centers, not just in Nevada, really across the country. And in fact, we saw our, what we call catchment area, where we see referrals, drastically expand during that time from Oregon and Idaho and even other states. Like we would get transfer requests from Texas and even as far as the Northeast. And that was because the centers that historically had supported those regions were really locked down. They were challenged to create the capacity to serve those patients. In 2022, we kind of redefined our commitment to our rural hospitals and our rural communities. It's always been an important part of our mission. It still is today. And we really bear down on how do we make sure that these rural communities have access to our services, both in the hospitals and out of the hospitals when they need it. And we've made tremendous progress in the last 4 years, probably increasing that by 300 or 400% from where we were back in 2022 as far as just transfers coming into the hospital.
And I think that's where it comes down to how do we maximize our different resources and campuses and hospitals to be able to create capacity at Renown Regional. There's the throughput, there's the both admission and discharge process, but there's also the physical limitations, right? That's where South Meadows comes into play. It's creating for that patient that could otherwise come to a South Meadows, to a community hospital. Let's utilize them there and create capacity for the trauma center to be able to receive those patients that are actual and critical need of a trauma center. At the same time, we're creating more transport from those rural communities into South Meadows. And again, from a rural hospital, there are times where they just need that upper level of service from a GI, urology, or other specialty coverages that they could otherwise be in a community hospital, but they just don't have those specialties within their community, given the ruralness of it. So we've utilized South Meadows in a different way too, creating not just capacity at Renown Regional, but as a network, we're creating capacity together.
Yeah, it really touches on that optimizing care distribution piece. As far as if a patient can be served at South Meadows, it's always better for them to get to that place, especially coming from a rural community. They're more comfortable in a community type of hospital versus a big urban tertiary center. The other thing I would say is, taking the patients to the hospitals that need to come is really one piece of that strategy. The other is, as we step further into the strategic plan, is how do we support those rural hospitals to transfer the patients that need to come to us, but the ones that don't need to be transferred to us that can be served in those communities. Maybe it's with changes in resources and how we support them or how we partner with them. That's really the work ahead of us, is how do we make sure that rural health care can be delivered in the rural setting to the extent possible, and then we're available when patients need that higher level of care.
Yeah. Example of that too is radiology. Radiology is strapped thin throughout the country and even more so in rural communities. We're starting to have those conversations. How do we stabilize our radiology coverage with our physicians here locally, and then start to plan to extend those services and create that continuity between the rural sites and our tertiary and or our hospitals here, to where it's seamless, right? They can see and have one image at one location and ultimately have that seamless care into Renown.
Interesting. You touched on something that I'm just super curious about. You said people are more comfortable in the South Meadows location than the regional. Is that something that you're aware of when you're building a place like that, or how do you learn that about folks, and what do you do about it?
A little bit of it's assumption. You're coming from a rural community, really small hospital, and then all of a sudden you're in this hospital that has 3 big towers, and it's, a little bit challenging to navigate at times. It feels a little bit more comforting, I would say, being transferred into a South Meadows from that type of scenario. And South Meadows can provide a lot of that care, and oftentimes it was bypassed. And so what we've really just done is we've really determined what can South Meadows take care of, and we do try to transition patients into there first, because it is a little more accessible when the family comes to visit it. They can park in front of the hospital, they can walk in, whereas at our main or regional campus, you have to park in parking garages, and you just navigate a bigger hospital. So a little bit of it's assumption.
Oh, that's cool. I mean, I think it makes sense. There's a lot of discomfort with hospitals in general for folks, because it generally means that something's wrong with you. And so breaking down those barriers seems really important, even for local urban folks, and then rural folks who are used to maybe working with a doctor who they also see at the diner or go to church with, things like that.
Yeah. Well, to that point, patient experience has been much more of a focus over the last, I would say, 10 years, 5 to 10 years in a hospital setting. That's a big focus, is can we create the right setting? Can we create the right interactions and have that communication style with the patient to where they feel engaged in the work? Because to your point, when someone comes to the hospital, first of all, they don't want to go to the hospital. No one wants to come visit us, but we're there when they need us, right? And so how do we create that environment where they feel respected, comfortable as humans, not just a number, not just as a patient, but rather that they're part of their care that's being provided? And so that's the type of environment we're both trying to create across Renown networks, is create that experience. And ultimately, sometimes it's just easier to navigate a smaller setting and have that one-on-one interaction and that community type feel hospital.
Yeah, when you need the complex services and you need 2 or 3 specialists consulting on your care, Renown Regional is absolutely the right place to be. And that naturally comes with bigger hospitals and maybe a little more difficult to navigate. But I think that we have the mentality of serve the patient where it fits them best. And South Meadows can do a lot of things for a lot of patients coming from these rural communities that they can't do in those rural communities. And so the value is being able to get them to that hospital and maintain the resource of the regional campus for those patients that truly need it.
Very cool. Both of you have mentioned the phrase networks a couple of times, and that's also one of the pieces of the pillars. Is network, what does that mean to you guys? What is a network in the medical sense?
I think that I'm just generally speaking, the Renown network in my mind is you step into any Renown facility and you feel that same type of care, the same type of or that you. Man, I can't speak now. My tongue's tied. It's really just creating that same experience throughout the different types of services, from primary care to urgent care to emergency services to the hospital setting. again, they feel and know Renown and feel that comfort and confidence in the care that's being provided.
Yeah, I'd kind of liken it back to one of the other pillars of this strategic plan, which is the people pillar and the culture that we're really creating. And Dr. Erling coming in, I guess 3 or so years ago now, and saying people first, and that we're going to be a people first organization. And that, I think, has really caught on. People now can kind of understand what our cultural aspirations are, and kind of how we orient ourselves when we make decisions. And to Sam's point, when you come into a clinic, you get the same engagement, you get the same level of service and support that you get in a hospital. So I think it's just trying to create a seamless and consistent experience across the whole network. And that's if you're a health plan member, that's if you're in one of our clinics, it's if you're in one of our hospitals. A great example of that is patients that do transfer into South Meadows, because at least based on what we know when we make that transfer decision, are appropriate for South Meadows. If they get to South Meadows and realize that they need some additional services that aren't offered there, it's not like it's a long process to be transferred to the main campus. You're kind of already in the family, if you will. Now it's just hey, we need to escalate this one level further to get the patient the resources they need, and that happens fairly seamlessly now because of that integration.
Gotcha. So it's not like someone's going to be, referred in and out of different private practices and have to redo all the paperwork and start over. It's just that it's time for you to head up to the other campus. It's just down the street.
Exactly.
And keep working on you.
One contiguous EMR too. So when you're a patient in some of our specialty care or primary care, all of that flows with you into the hospital and out of the hospital and back into those specialty and primary care offices. And so there's a lot to be said about being on one integrated platform as far as for all of your care.
Gotcha. So when it talks about strengthening the network of physicians and providers, is that basically what we've been talking about most of the time, or is there like another deeper layer of what it means to you to strengthen that?
Yeah, I'd say that there's some components of that. The physician enterprise makeup of the medical staff, of both independent employed physicians, really trying to create an environment where everybody's engaged in that mission, right, for that patient, the outcomes. And there's, if you look at our physician enterprise, there's variety and variances between the different groups of the engagement in the mission. Are they is the physician group specific and focused on what their needs are as a private practice or an individual physician, or are they working with us to really further that mission and strategic plan? And so I think those are the certain areas that we're trying to stabilize and saying, okay, I'll use radiology and anesthesia as a perfect example. They're nationally, that's been a challenge, those two specialties, but they're critical for a hospital to continue to further. In both areas, we've been able to partner in a different way to stabilize their physicians and their structures to be able to help us and align with us and ultimately grow with us. And anesthesia is a perfect example. As they've been a little bit further along, they've been able to recruit, retain, and ultimately grow with us, strategically grow with us, and allocate resources where appropriate.
Are you bringing up those two because they're, I think, traditionally sort of like a separate entity, right?
They've historically been a separate entity and currently in both private practice settings. But we partnered with them to be able to, because they're so essential, right? They exclusively provide services to Renown. They're still independent, but very much mission aligned in how do we create access for our community. As when you think about a patient coming to the hospital, if they need surgical care, anesthesia is a huge part of that, right? For timely care, for access, and partnering with the surgeon. At the same time, radiology, when you come to the emergency room or inpatient stay, most likely case, you're going to have some type of image occur during your stay. And ultimately, the radiologists are behind the scenes doing that work. And if that's not a stable resource or a good physician engaged workforce, that becomes a challenge and a roadblock for furthering our mission.
I think the other piece of it, we have phenomenal physicians in our community, and how do we more closely align with them and partner on things that are mutual goals. The other piece of this is we don't have enough doctors. Across the United States, across Nevada, across the Northern Nevada region. And so part of this, that academic mission is a big piece of this, and it's kind of been twofold for us. One is we entered into that knowing that part of the whole intent was to train more physicians here and thereby keep more physicians here. And when you have Dr. Hotman and Dr. Plouth and Chris Bossi on here, they'll talk about that, I'm sure. But the other piece of it that we've seen, so we are training more physicians in our community. We've started our pediatric residency, and we'll launch our OB residency in the next 6 to 12 months. But the other piece of it is we've seen a pretty big influx of physicians that want to come here because now they not only have a place to practice that they want to practice in, which has always existed at Renown, but they can actually now participate in research and teaching. And so there are physicians out there that's an important part of the practice to them, and if it's not available, then this wasn't necessarily a destination for them. And so we've seen a pretty big influx of physicians that are interested in coming here because we've created that academic affiliation built on top of a solid foundation of high quality care and a great place to practice.
That's awesome. That's also going to be a great thing for me to hit Dr. Hauptman with and talk more about. So I appreciate that for the next episode. So is there anything that I haven't brought up that you guys have been like waiting for me to ask, but you just want to talk about that hasn't come up yet?
I don't know. I think we covered most of it.
I think we hit on pretty much everything, keeping care local and how do we strengthen our provider and physician network. A lot of focus on the optimizing care distribution. I guess the last thing I'd say, two big pieces of this strategic plan, kind of the two big investments that we're going to make lots of investments, is in oncology. We're set to build a new cancer tower on the regional campus.
Wow.
We're going through the planning stages of that now. The intent of that is to grow our cancer services that we offer, meaning the types of cancer services that we offer, some that aren't offered in our region. The other is about integrating cancer care. Cancer care is very complex, and in our market today is pretty fragmented. And so our intent is to bring that together. And so that's one big piece of our strategy. And then the big, hairy one that we have a little bit further into the strategy is the women's and children's tower that we intend to build. We are the only pediatric hospital in the region, or children's hospital in the region, within our hospital, but the intent is to create a dedicated space for our kids. They require a unique space and unique care. And the connection to women's is really important in that piece. And so we're really excited about both of those big building blocks of the strategic plan.
Wow, that's huge. I'm sorry I didn't ask about that before, but now I have a whole new episode I feel like we could do. So it's physically like new built-up towers for both of those?
Yeah. That's what's in the plan today. Obviously, we know that there will be a lot of inflection points as we work through this, but the oncology one is really in the forefront of the plan, and something that we were pretty head on and committed to going into this, and so we've really been able to kind of form that and shape it and know where we're headed with it. Really excited about it.
That's really cool. And what about anything huge towers being built in South Meadows?
Well, we just completed our 120,000 square foot expansion.
Oh, that's right. Yes.
So we right now we're in a little bit of a lull of ribbon cuttings, as everybody has given me a hard time about. But no, actually, we're going to start probably in 2026, 2027 timeframe of planning for a new medical office building on the campus. So that will just be creating more access for specialists and coming to on campus. And so that's exciting. And I just, the last point that I would make is, all these pillars are predicated on the foundation of operational excellence, right? And so on the day-to-day, these are all great things and absolutely the components and pillars that we need to focus on. But on the core, we got to continue to do the great work we're doing each and every day, right? We're focusing on our people, developing our people, recruiting talent that needs to be and where gaps are, developing our leaders and working with them and creating goals each year and where do we need to focus as a hospital to really solidify our operations. And so that's the day-to-day, and that's what fuels and accelerates this work that we've been talking about today.
Yeah, I think we'd be remiss if both of us didn't say that we'd have to give a huge shout out to our thousands of employees and hundreds of leaders that really help make that happen every day to make sure care is there, it's available, it's exceptional, and that it, to Sam's point, underpins this whole strategy. So just big thank you to all of our staff and leaders out there.
Absolutely.
Awesome. Well, thank you both for being here. I think this has been really interesting to see just how you guys are able to work together, reorganize and optimize the different elements of the buildings, or in this specifically the care across the city and even the state. So in our next episode, I'm really excited to finally talk to the School of Medicine and talk about the partnership that everyone has alluded to, but we haven't gotten into, and how that plays such a huge role in attracting talent and educating people and growing a nice physician base here in Reno.
Thanks for having us.
Yeah, thank you.
Renown.